Welcome to Adapting Place Pharmacology. This is Renal Pharmacology. I have a few questions, high topics in terms of medications that you need to know for renal. And so let's get to it. I'll solve these questions and I'll give you the key facts about it. And this at 14 weeks gestation, provide care for a client, prescribe what? Dutasteride, right? Which action by the nurse is appropriate. The key word is go to the medication. We know we're talking about pharmacology. What do you see? Steroid. All these steroids are what? Prostate medication. You have Finasteride. That's their last name. And they're designed to decrease the size of the prostate. What else do they have? They decrease libido, they affect your erection, and they are teratogenic. So a nurse should not hold it if you're pregnant. So the key word, this should not be questioned, right? Because it's the medication for a patient. She can still give the medication. Educate the client about priapism. Not do that because it does not cause priapism. What does it do? It causes erectile dysfunction. Wear gloves when handling the medication because it's teratogenic. Request a prescription for a Foley catheter. The medication opens the prostate and it's easy to pass, right? It's easy to pass, allow them to pass their urine easily. Therefore, they will pee without any problem. They don't need a Foley catheter. So that's the right answer. I'll give you the explanation. And then provide care for a client, prescribe Finasteride, the second medication. You see the last name, Finasteride. The nurse understand that the therapeutic effect of the medication is evident by what? The keyword Finasteride. The next keyword, buzzword, is therapeutic effect. That means it's working. The medication is designed to decrease the size of the prostate and allow urine to flow. Therefore, your urine, you're not going to have urinary retention. So they decrease urinary retention. Your libido is going to decrease. It's not going to increase. You're not going to have erection. You have erectile dysfunction, and it decreases the size of the prostate. So that's the right answer. Let's provide care for a client with end-stage renal disease. Prescribe what? Sevelamer. Which action the nurse should take regarding the prescription? Go for the buzzword. Always go for the buzzword. The question is asking you about what? Sevelamer. If you don't know, why would I give Sevelamer to somebody? Oh, they have end-stage renal disease, but you have to know why you're giving to them. This is given to lower your phosphorus, right? And it works when you take it with medication because there's phosphorus in your. It works when you take it with meal. If you eat after you take it, it's not going to work. It's supposed to prevent you from absorbing phosphorus. Therefore, administer the medication on an empty stomach. No. Administer the medication with omeprazole. Antacid is never good. You don't take medication with antacid. Administer the medication with meal. It's very good. Administer the medication 2 hours before meal. No, you got to take it with meal. So the key answer choice is Sevelamer has to be taken with meal. And let's provide teaching to a client with end-stage renal disease who is prescribed what? Calcium carbonate. Which statement by the client indicate the need for further teaching? When they give you questions like that, you can figure out what you need to do. Go back to the buzzword. Calcium carbonate. Patient has end-stage renal disease. That means he's doing something for a patient who has end-stage renal disease. What do you think? What medication would it be? It's calcium. People with end-stage disease have low calcium. I give you low calcium, I give you medication for low calcium, it's going to increase your calcium. What does it do next? It lower your what? Phosphorus. It may increase their calcium, but the main function for calcium carbonate is to lower your phosphorus. Therefore, I will take the medication with food. Yeah, it does not need further teaching. I will avoid fish, nuts, and beans. Yes, it has too many phosphorus in it, so you should avoid it. I will stay on high fiber diet. Calcium carbonate causes constipation. I will take the medication on empty stomach. No, it does not work. You take it with food. And then provide care for a client with end-stage renal failure. The healthcare provider prescribe what? Sevelamer. You've seen it already. Which laboratory abnormality the nurse know the client the medication was prescribed for? I'm trying to give you everything they will test you on. Sevelamer is for your phosphorus. So I'm going to lower your phosphorus, right? Elevated phosphorus is the problem. Watch for decreased calcium. No, it's not prescribed for decreased calcium. It's prescribed because I want to lower your phosphorus. So that is the key. The client report taking saw palmetto for BPH, benign prostatic hyperplasia. Which medication on client medication list the nurse required follow-up with the healthcare provider? Saw palmetto is used for what BPH by herbal technique, right? Herbal medication for BPH, but it can make warfarin, it potentiate the effect of warfarin really bad. So that's what you need to know about it. It causes gastritis. So retinidine is good. Omeprazole, it helps with your stomach upset, right? So you can take it with it. And nurse has attended staff education program of diabetic nephropathy, which prescription the nurse should anticipate the healthcare provider will prescribe for a client showing evidence of diabetic nephropathy. If you have diabetic nephropathy, your kidney is not working well. There is a leakage of protein. And therefore, what do you need to help you in terms of that function? Look at the answers. Naproxen is going to worsen your kidney function, right? Spironolactone, it makes you dehydrated, right? Prednisone, even though it's good, it does not affect nephropathy. So ACE inhibitors are very good in helping with diabetic nephropathy. And let's provide teaching to a client prescribe oxybutynin. Which statement by the client indicate teaching is effective? Oxybutynin is used to slow down what the bladder function. So if the bladder contract too much, urge incontinence, you slow it down. But the problem is it's an anticholinergic effect. Therefore, if it has anticholinergic, it will cause anticholinergic side effect on you. I will stay on high fiber diet because anticholinergic causes constipation. I will have sugar-free candy with me at all time because of dry mouth, right? I will buy artificial tears to help with the dry eyes because your eyes is going to get dry. I will feel drowsy sometimes when on the medication, anticholinergic. I will inform my doctor about the medication if I develop glaucoma. You should avoid anticholinergic in glaucoma. I will avoid hot weather and prolonged outdoor when sunny. When you have anticholinergic, you can sweat. And so heat intolerance is a big problem, so you should avoid it. And next is teaching a client about management of benign prostatic hyperplasia who is interested in herbal regimen. Which herbal medication the nurse should recommend? I already given you the answer. You know, it's Sulpomate, St. Johnson's for depression. Ginger is usually for memory and then some GI symptoms, right? Black cohosh is mostly for menopausal symptoms. So this is the problem. NS has attended staff education program about hypertension pharmacology. Which prescription the nurse should anticipate to be prescribed to healthcare to treat both hypertension, BPH when caring for a client with this condition? Basway. A patient has hypertension and BPH. Which medication will you prescribe for that patient to treat both? Keyword, alpha blocker. Alpha blocker. What is their last name? Terazosin, right? Or terazosin. Terazosin is number one. Dutasteride, number two. Tamlidine, number three. And Alfuzosin, number four. Another keyword, their alpha blocker side effect is what? Orthostatic hypotension. Therefore, you should not take nitrate and you should not take calcium channel blocker, which causes orthostatic hypotension. And then provide teaching for a client prescribe Alfuzosin for weak urine stream and initiating urination. Which teaching the nurse should include? So we provide alpha blocker, right? Alfuzosin. So which teaching should you include? I told you key aspect is what causes orthostatic hypotension because of alpha blockage. take the medication in the morning. You should take it at night because of orthostatic hypertension. You may continue to take nitroglyceride I prescribe. You cannot take it because it causes orthostatic hypertension. Change position slowly, right, from sitting to standing position. You may continue to take sildenafil. You can't take anything that will cause orthostatic hypertension. And next is reviewing phone call from 4 client prescribed oxybutynin for urge incontinence. Which client should the next see first? So it causes bladder not to contract, and then it causes urinary retention because you have urge incontinence. Report last bowel movement for 2 days ago or anticholinergic effect. Okay, fine. Report buying artificial tears to lubricate the eye, anticholinergic effect. Report chewing non-sugar hard candy for dry mouth, anticholinergic, right? Report last urine output 24 hours. Urine retention is bad compared to all the 3, so I'll pick that one. NCLEX attended staff education program about pharmacology for incontinence. Which medication the nurse should anticipate for the management of urge incontinence? We've seen it already and range this to like repetition. So urge incontinence, that means they're going too fast. The best way is to slow down. The best way is to slow them down. If you see any medication that has the last name call, you speed up the bladder function. So call. That is the only way you can memorize pharmacology for urine and nephrology, right? So this is not the core. So this is oxybutynin, right? This is sulfenazine. This is daraphenazine. They all look the same. The core will speed it up. The patient already has urge incontinence. We don't need to give it to the patient. And then administer the prescribed sodium polystyrene sulfonate to a client with end-stage renal disease. Which laboratory finding the nurse should anticipate? Select or apply. Buzzword. Go with the buzzword. The buzzword is sodium styrene sulfate. This is Kayexalate. It's given to lower your potassium. It lowers your potassium and increases your sodium. It exchanges potassium with sodium. Therefore, in that case, sodium goes up a little bit, phosphorus goes up, potassium goes up. It does not affect your kidney. It does not affect your phosphorus or calcium. So those are your right answer. The client with urinary tract infection is prescribed Finasteride. Which teaching is appropriate by the caring nurse? The medication will cure the bacteria causing the infection. No, it does not do that. This will treat the pain and burning associated with the infection, right? Wear eyeglasses during the day, during the duration of the prescription because it's going to stain your lenses. Apply sanitary napkin in your underwear. That is good. Expect bright red, orange during discoloration. That is good. So those are your answers, right? So this is the end of it. Thank you for joining us. Thank you for enjoying this. Thank you for watching. Take care of yourself and bye.